Christy is at University of Georgia. Am I right, Christy? And both will be working with us part-time on issues around the Alliance. So welcome them. You'll probably be seeing things from them. And I am excited that we are being able to have some staff to really continue to move this project forward and all the related projects. So Helen, who's been with us for 3 months as a law fellow, is going to be leaving us soon. So I want to thank Helen for everything that she's done to date and look forward to working with her as she continues completing her degree and continues to work her way through as a public health professional. And the Policy Action Institute is coming up on June 15th and 16th, and you should have received some information. You will be receiving more information coming up. So going to be another really interesting mix of federal, state, and local professionals talking about how to best address public health issues. What are some of the solutions that are working? What are some of the areas where we have the most problem and we need to work together? Day 2 is really going to focus on a hands-on experience. So we're looking to bring in a lot of students and early career professionals, as well as anybody else who's interested in advocacy and communicating about public health, to learn about what works and what doesn't, and then put that into practice. So I'm happy to take more questions about that in the future or at any time, and look for more information coming forward. Talk a little bit about the Alliance work. I want to make sure that we are able to all be on the same page as we start this meeting, and then I'll turn it over to Angie. So I just want to, the work of the Alliance is really to work on a common agenda, a common action agenda to advance our public health system and engage and support communities and community coalitions. We've had a lot of good discussions in recent weeks and focus groups with partners about this work, and we're currently refining and refocusing the goals and priorities that we heard from key partners and from all of you in the various meetings and opportunities we've had to engage in the last several months. We're developing a report, and we'll come to you in June with more details and about that with that report. And the report's really going to focus on the steps we've taken, the lessons to date, and our proposed action steps to accelerate improving our public health system and to support and coordinate activities. This is all based on the work that we have done together to date. And so it really, excuse me, I took a cough drop before this just in anticipation, but clearly did not work. So we look forward to sharing more information about our progress and about potential next steps by our June meeting. And we really do look forward to continued engagement as we move forward to create a public health system and a health system that really works to create health in this community and in all communities. So with that, I think next slide and turn it over to Angie.
Yes, thank you so much. And I apologize if some of you ended up on our old Zoom link. I know we had to switch it over, and apologize if there were any confusion. So hopefully everybody found our place here. But we're so excited today to have a chance to hear a little bit more about some of the work our partners are doing to support the large national public health infrastructure grant program from CDC. While it's a joint initiative from ASTO, FAB, and NMPHI, our NMPHI colleagues have agreed to give us a little update about what they're planning and how they will help to support these amazing funded projects throughout the country. So with that, we have Montrese Ransom, who serves as the director of the National Coordinating Center for Public Health Training at NMPHI. She leads the Coordinating Center's efforts to elevate public health practice across the country and oversees the promotion, creation, and distribution of high-quality, relevant, and accessible training and education opportunities for the public health workforce. Before this, many of you all may know Montrese from her time at CDC with the Public Health Law Program and a couple other places. So welcome, Montrese. We also are glad to have April Klein. She is a senior public health analyst with the National Coordinating Center for Public Health Training at NMPHI. In this role, she provides project management support and subject matter expertise to their development initiatives. This includes partnering with public health training centers and institutes to plan, develop, and coordinate technical assistance, which is provided to state, local, territorial, and tribal health departments across the country. Before she was at NNPHI, she spent 4 years at Health and Human Services departments in Texas, both Austin and Dallas, where she focused on health and social service strategic planning and research. And last but not least, Caitlin Canfield serves as principal research scientist with the National Network of Public Health Institutes. She's a senior leader and public health expert with 16 years experience with equity-grounded, community-engaged public health school and community-based and healthcare programs, assessments, evaluations, and research. She's a subject matter expert in sexual and reproductive health and maternal and child health, and she brings a background in clinic-based social services as well as international public health. With that, I will turn it over to them and let them share their slides. So thanks so much.
Thank you, Angie. And while April is getting our slides up, I just want to say good afternoon to, I think, most of you who are on the East Coast like me. Good morning to some of you who may be on the West Coast, which they say is the best coast, or coming from other places, from other time zones. I'd like to also start by saying that our CEO and my co-PI on this project, Benny LaFranza, he sends his regrets. He had a conflict, so he can't be with us today. So Caitlin, April, and I have the honor of talking with you a little bit about who we are at NNPHI and discussing a little bit about our role and the roles of our national partners in the Public Health Infrastructure Grant Program. We are super excited to be working with both FAB and ASTO as national partners on this grant. And we all see this as an opportunity, this investment as really what we need to begin to equip state, tribal, local, and territorial public health agencies to be strategic about improving the problems in the public health system that we see and improving cross-sector collaboration so that we can strengthen public health capacity and advance public health in every community in this country. So as mentioned, my name is Montrese McNeil Ransom, and I serve as the director of the National Coordinating Center for Public Health Training at NNPHI, also known as NCCPHT. As Angie mentioned, I'm joined by April Klein, who's a senior public health analyst on my team, and Caitlin Canfield, who serves as a principal research scientist within the Evidence to Action portfolio. Next slide, please. Evidence to Action is our evaluation portfolio, also known as E2A, and the National Coordinating Center for Public Health Training. We are 2 of 8 portfolios within NNPHI. And from our bridging portfolio to our health and racial equity portfolio, our work is cross-cutting. It's necessarily cross-cutting across all of our portfolios and all of our programs. Everything that we work on within NNPHI necessarily has a cross-portfolio touch point. And we all work together toward a mission. You can go to the next slide. Of mobilizing 47 public health institutes throughout 32 states and growing, including more than 8,500 subject matter experts. And our mission is really focused on doing work that results in measurable improvements to public health structures, systems, and outcomes. And I hope you can see how our mission and vision align with the goals of the infrastructure grant and support our technical assistance hub model as we go through our presentation today. Next slide. Now, I know just seeing the names of the folks who are on this call that many of you are familiar with NNPHI and our institutes. But for those of you who aren't, public health institutes are nonprofit organizations across the country that aim to foster innovation, to leverage resources, build partnerships across sectors, and to really play the outside game. So building partnerships with government agencies, communities, healthcare delivery, media, academia. They are system partners, and they have the capacity to operate with agility and speed and flexibility, and they're core to our approach to the public health infrastructure grant work. We see this speed, agility, and flexibility as central to our work in the public health infrastructure grant technical assistance hub model. So next slide. I'm going to talk a little bit about the public health infrastructure grant, provide some background, and then turn it over to April to talk a little bit about our technical assistance hub model. All right, you can go to the next slide, April. So according to CDC, this public health infrastructure grant is meant to provide a foundation for their public health infrastructure work. And over the 5-year period of performance, the goal is to help create a stronger, more resilient public health system that is prepared to face future public health threats, whatever they may look like. The grant is made up of 2 components. Component A provides funding to state, tribal, local, and territorial health departments so that they can strengthen their workforce and improve their foundational capabilities. And component B provides funding to national partners, so NNPHI, ASTO, and FAB. And our job is to support the work of the component A recipients by providing training, technical assistance, evaluation, communication, coordination. If you go to the next slide, you'll see a snapshot of component A. You'll note that there are 107 US jurisdictions that have received funding to support key strategies across workforce, foundational capabilities, and data modernization. Next slide. As mentioned before, there are 3 national partners that received grant funding to support the work of the component A recipients. Next slide. ASTO, FAB, and NACHO are working together to provide training, technical assistance, support grant evaluation, as I mentioned, as you'll hear from Caitlin in just a few minutes. And we're also facilitating coordination and communication across grantees and CDC. And you can see our broad goals listed here on this slide. But ultimately, we want to use existing resources and develop new and innovative tools that help transform the public health workforce. That's the language we're using. We're transforming the public health workforce with this investment. And so I want to lean into how we plan to do that individually and collectively. And I'll start first with ASTO. So next slide. You can go to the next slide. So as most of you know, ASTO focuses on state and territorial health officials. The mission is to support, equip, and advocate for state and territorial health officials in their work to advance the health of the communities that they serve. Next slide. ASTO's approach to the infrastructure grant centers these key elements that you see here and really builds on their strengths and brings in key partners to extend their capacity and expertise, to amplify their capacity and expertise. Next slide. Wide variety of partners. As you can see here, partners include the Big City Health Coalition, ASTO's affiliate organizations, including APHL and CSTE, and many more. ASTO's work in the infrastructure grant really focuses on increasing hiring mechanisms that are available to the grantees. You can go to the next slide. Expanding their efforts to build strong organizational leaders, including an expansion of their highly acclaimed leadership institute, the ASTO Leadership Institute, ALI, and expanding that model for key component A grantee positions, including senior deputies, workforce directors, informatic directors, data modernization directors, and the list goes on. Next slide. Another area of focus is around employee retention and well-being and resilience. So ASTO has been working to develop this new culture change initiative for agencies, and it's called Public Health Hope, Public Health Hero, Public Health Hope, Equity, Resiliency, and Opportunity, so Public Health Hero. And the program aims to address this need we see in the workforce, and instead of putting the focus on individuals in the workforce, putting the focus on organizational and cultural change. Throughout the 5 years, you can go to the next slide, April, you're fine. Actually, I think go back. Back one more. Okay, go forward once. All right, perfect. So over the next 5 years, ASTO will also develop and promote technical assistance, capacity building products, cohort-based learning opportunities and learning communities, quality improvement, performance improvement activities, and trainings to support workforce recruitment and hiring. And their emphasis is on diversity, equity, inclusion, and accessibility. Next slide. ASTO is also in the process of building out a new ASTO Star Center to conduct peer-based assessments of administrative capacity against evidence-informed capacity indicators of foundational capabilities, and to support accreditation or reaccreditation efforts. Next slide. And ASTO also has a role in supporting Component A recipients and data modernization activities. And if there's anyone representing ASTO on the line, we'll open up some time toward the end of this call for you to offer any additional comments or thoughts on your approach with the infrastructure grant. The next question is, where does PHAB fit in? And so PHAB's goal is to serve and support the Component A grantees as the accrediting body for public health departments in their goals towards getting accredited. And their mission is to advance and transform public health by championing performance improvement, strong infrastructure, and innovation. To this work, PHAB is bringing several strategies and tools for transformation. For example, PHAB houses the National Framework for Foundational Capabilities. You can go to the next slide. Excuse me, for foundational public health services. And those were born from the 2012 IOM report on public health financing. And they're really the framework for a number of state public health systems that they're using that underlie their transformation or modernization efforts. Next slide. The foundational public health services are aligned with the public health accreditation standards and measure very directly, with 34 of nearly 80 measures having direct alignment. Next slide. The PHAB Innovation Center also fosters the 21st Century Learning Community, which is a group of 18 states that are working to transform systems. And some of the work that they're doing is directly related to the work of the Public Health Infrastructure Grant. You can see on this next slide some additional PHAB tools for transformation here. And then the next slide is something that's important to mention, and it's a tool that PHAB is developing to really support the infrastructure grant work, but beyond, and it's called PHIDS. And PHIDS enables public health agencies and statewide systems to see where they are and what next steps to take in their public health transformation. It's about collecting and using this data in a way that allows for a strategic approach forward to transforming their public health systems. Next slide. And PHAB is also working with us on evaluation. And I'm going to let Caitlin discuss that in just a few minutes. So I've tried to move really quickly through this so that you can learn a little bit more about NNPHI's TA Hub model, which April is going to talk about. You all have copies of these slides, and we'll open it up for questions and conversations at the end. I've talked to you a little bit about who we are at NNPHI, the basics and the goals of the infrastructure grant, and what our national partners, PHAB and ASTO, will be contributing. But it's important to hear about what we'll be contributing in our TA Hub model, and I'll pass it to April in just a second. But before we do that, real quick, April, I just want to point out that as national partners, we are committed to ease for the grantees. That's the language that we've been using. We're committed to a one voice model so that we show up as one, as a comprehensive group that's available to support the Component A grantees. And we've created structures that allow us to contribute individually and collectively to all the major activities that are a part of this opportunity, so that we're contributing to activities, even if each individual organization is not necessarily the lead of those activities. We've established a steering committee, including key lead staff from each organization. We meet weekly to discuss strategy and operations. And we have working groups, which include staff from each organization and subject matter experts. And everything we do is meant to be done in a manner that reduces the burden and increases value for the grantees, making it possible for them to engage and really benefit from the work that we're doing. And so with that, I'll pass it to April Klein, our senior public health analyst, who is leading our TA approach on this work, to talk about NNPHI's TA Hub model. April?
All right, thank you, Montrese. Hi, everyone. April Klein, Senior Public Health Analyst with the NCC PH2 portfolio. So I want to share a little bit about our TA Hub model. So this model leverages local, state, and regional expertise to support government and public health agencies So this allows NMPHI to coordinate technical assistance, provide programmatic services, support analysis and identify trends, and build sustainable relationships among public health institutes and state, local, and tribal island jurisdictions. One of NMPHI's core roles in the infrastructure grant program as a national partner is to triage the system. So, we get these TA requests from our health department grantees, and we'll triage them to our national partners and our hubs based on the level of expertise and SMEs within each one of those organizations. So this hub model really leverages the speed, agility, and flexibility of our public health institute partners, and it allows us to provide TA in a way that builds sustainable relationships among public health institutes and the state, tribal, local, and territorial health departments. So NMPHI is, I would consider, a pretty experienced leader in deploying this model for health department technical assistance and workforce capacity building. Following the 2017 hurricane season, NMPHI supported preparedness capacity building across jurisdictions impacted by Hurricanes Harvey, Irma, and Maria. As the National Coordinating Center for Public Health, the National Coordinating Center for Public Health Training, and NMPHI coordinated efforts across 5 technical assistance centers led by public health institutes and public health training centers in Texas, Louisiana, Florida, Georgia, and Puerto Rico. This map obviously is not to scale, it's just provided as a visual aid. So these technical assistance centers served as the coordinating body within their jurisdiction, working with a range of local, state, and regional partners to lead public health workforce capacity building activities and disaster-related surveillance, environmental, and occupational health needs. So thus, NMPHI is very well positioned to implement a similar approach for public health capacity building using this hub model for the public health infrastructure grant, only bigger and better, with a lot of lessons learned from this hurricane response hub program. So this map provides a visual of the national reach of the TA innovation hubs. There are 9 hubs covering 10 regions. As Montrese mentioned, there are 107 health department grantees, state, local, and territorial. These hubs have anywhere from 6 to 21 funded health departments under their purview, so to speak. A few hubs also have official, what we refer to as spoke partners, that ensure inclusion of these sort of maybe harder to reach health departments. A few examples of this is that the Public Health Institute, which covers regions 1 and 2, has a spoke partner, has the Hawaii Public Health Institute as a spoke partner. Public Health Management Corporation partners with the Puerto Rico Public Health Trust, and the Trailhead Institute in Colorado with region 8 partners with the Montana Public Health Institute. So we hope to continue to build spoke organizations into these hubs as the work continues to develop. So NMPHI will provide tailored training and technical assistance via this regional hub model. I touched briefly that TA requests that are assigned to NMPHI will be triaged to the regional location of the regional hub where the request originated, whenever possible, or to another hub site that has that subject matter expertise to respond to the request. One of the main goals of this approach is developing relationships that can really last beyond the lifetime of this grant. We want to build sustainability in from the beginning. These sites will both respond to tailored technical assistance requests and will plan several proactive TA projects each year, some independently and some in partnership with others. And all of these proactive projects will be in collaboration with the national partners as the WNFAB to reduce any duplication of efforts, and even in collaboration with various hubs as well. So it provides a snapshot of the hub services and supports. Our hubs offer various approaches to technical assistance, supporting programmatic services, analysis and assessments, and sustainable relationship building, both across health departments, across hubs, and across partner organizations. So some examples of technical assistance that we've received, that we expect to receive, that we've received so far. So the technical assistance basically comes through these TA requests, and then there's also a proactive TA. So proactive today, we kind of mean, we hope to develop some webinars, trainings, various forms of proactive TA that is responsive to what we know about the needs, providing tools before the health departments ask for it. So I won't read these out to you, but these are just a few examples of what our hubs can do and the type of technical assistance that they can provide. And I would just emphasize that, we're really focusing on supporting connections between jurisdictions doing similar work to share challenges and lessons learned and try to make this sustainable and equitable just beyond the 5-year grant. So I think with that, I will pass it back to Montrese to share more about other resources that NPHI has that will support this technical assistance delivery and that will be utilized to support the broader activities of the public health infrastructure grant work. And first, we'll talk about the racial justice competency model. So I will pass it over to you, Montrese.
Thank you, April. So as April mentioned, we have several resources similar to our partners, ASTO and FAB, that exists already, and we're developing new resources. And so I'll start first with the racial justice competency model, as you see on the screen there. This model was catalyzed and supported by NPHI and developed by an expert review work group that was convened by the Public Health Training Center Network, the 10 HRSA-funded public health training centers. This racial justice competency model, or the RJCM as we call it, is meant to really ground a shared understanding in the field of how racism shows up in the everyday practice of public health, and to help build the capacity of the workforce to help reduce the racial health equity gap, really starting at home, but moving through the work we do in the communities that we serve. And it's meant to be a tool to hold public health practitioners accountable to our health equity and social justice principles in a clear and measurable way. So the goal here is to offer technical assistance and guidance to the recipients on how to use the racial justice competency model to their training and development programs. And we plan to work with at least 5 recipients annually to audit trainings, audit job descriptions, or performance appraisals using the racial justice competency model. And then we have the Public Health Learning Navigator, which I know many of you are familiar with. It's a curated online training resource. We're currently launching Learning Pathways. We did a LinkedIn live launch just a couple of weeks ago. But the pathways are meant to provide learners with a complete training curriculum, and they will be developed based on the core competencies for public health professionals and the racial justice competency model, as well as the results of the needs assessments that are a key component of this public health infrastructure grant work. And NPHI also serves as a public health ECHO super hub, whereas we provide training and implementation to support the ECHO model. And ECHO, if you've not heard of it, it's an innovative peer-to-peer training model that really began in the medical realm, but is expanding more to the public health sphere. And we're excited to share that we'll be doing an infrastructure and health equity focused series of ECHOs starting in June. And NPHI also has a suite of performance improvement programs that are offered annually or on an ongoing basis that are embedded in our public health infrastructure grant work. FIT is a skill building convening, for example, that features hands-on workshops, networking events, a wide variety of sessions around all things performance improvement, including workforce development, strategic planning, and quality improvement. And I'd like to bring your attention to one of our flagship convenings, the Open Forum Next Generation, which is one of our annual convenings, and it provides public health practitioners with an opportunity to learn and engage with peers around critical topics currently facing both the public health workforce and the healthcare workforce. And again, we're grounding this work in the needs that have emerged from the public health infrastructure grant work that we're doing. NxGen will be held September 27th through 29th, 2023 in Indianapolis. And there will also be a virtual option, so it'll be a hybrid meeting. And we're also purposely providing opportunities for networking, learning, and collaboration among grantees and national partners at this meeting. And if you're interested, the call for abstracts and registration for that meeting is launching in just a couple of weeks. So that's an overview of the grant, the national partners, a snippet of what TA looks like and what it might look like moving forward. But how will we know if any of this works? How will we know if or how we've transformed the public health workforce? And that's all in the evaluation. And with that, I'll turn it to Caitlin Canfield, to talk with us a little bit about the National Evaluation Team.
All right, thanks, Montrese. Yes. So I'm going to try to provide you all today with also a snippet, a bit of a viewpoint into the work that is ongoing to evaluate the Public Health Infrastructure Grant Program. Next slide, please. So first, I'd like to give you, kind of introduce you to the national evaluation. So 2 of the component B national partners, NNPHI and FAB, were funded to conduct an evaluation in collaboration with CDC of the infrastructure grant. The vision and really what we want to accomplish is to complete an evaluation that is both utilization and user focused, and that it's really designed to meet user needs of the grant. We define users expansively. Some examples, though, are the CDC, recipients of the grant, including both component A, those local health departments, as well as component B, the national partners, and then other public health partners as well, right? There are so many different partners within this broader public health ecosystem that this grant undoubtedly will touch, and hopefully the findings will have implications for, or build an evidence base for, or be used. So the goal of the evaluation is to produce findings that will be used for both practice and policy. So we're hopeful that the findings, and we're going to be driving towards ensuring that the findings both inform proactive change adjustments during the initiative, and also that the findings are used to affect policy moving forward. Montrese spoke earlier about the guiding principles that all of the national partners have adopted in our collaborative work as part of the infrastructure grant. And so the National Evaluation Team, which again is comprised of FAB and NNPHI, and then in very close collaboration with CDC, is going to seek to accomplish its goals of completing this utilization user-focused evaluation by engaging the actual users of the evaluation data in the design. And I'll talk a little bit more about that on my next slide. Also reducing the burden on recipients by following that one voice model that Montrese mentioned, by sharing decision-making across both the national partners, but also with the users of the information. And finally, we're committed to an ongoing dissemination of findings to diverse end users and audiences, including recipients, the CDC, broader public health sector, Congress, community members, et cetera. Next slide, please. So again, this is a high-level overview. This is actually going to be my final slide, but I want to give you an idea of how the National Evaluation Team orients to both the CDC and also an idea of how we're approaching this evaluation. So the National Evaluation Team, or the NET, as we're referring to ourselves, and the CDC have been working in close collaboration since December, when the grant came down, to design the approach to the national evaluation of the infrastructure grant program. And so a key facet of the approach to the national evaluation of the grant is the inclusion of an evaluation advisory group. So that's that gray box over to the left. And the advisory group is designed to ensure participation in the evaluation by the grantees, by CDC, and by other public health partners, and to provide a mechanism for participants to engage with and inform how the evaluation is actually designed, as well as how it's implemented and how findings are interpreted and disseminated. And we're seeking to leverage and embrace best practices in participatory evaluation to help drive the design for the evaluation advisory group. Also foundational to the National Evaluation Team's approach is the development of a national evaluation plan. And so that is the horizontal gray box just below the net. So the National Evaluation Plan will guide all of the proposed data sources, the methodology, the analyses, and proposed dissemination of findings, all of which are in continual conversation with, informed and guided by the Evaluation Advisory Group. The evaluation plan will include formative, process, as well as outcome and impact evaluations, and it will also include different sub-studies that are focused on like particular topics or areas of interest to both the NET, as well as particular topics or areas of interest that come up through the evaluation advisory group or through preliminary findings. So that's kind of an overview of the national evaluation team and of the overarching approach that we're taking to evaluation of the infrastructure grant. I'm not sure if I'm passing back to Montrese for the final slide, the what's next.
Sure. I mean, ultimately, we're looking forward to continuing this conversation. We received this funding and the go-ahead on December the 1st, and it's taken a while to stand everything up and kind of get structures in place. And we're really now just beginning to dig into the work and contract with partners, many of whom are on this line. So we're really looking forward to continuing this conversation and to exploring ways that we can work with APHA and the Alliance and other partners to support grantees now and over the next 5 years. But it's important to me that we also think about how we make this work sustainable beyond the 5 years. You know, what does it look like to ensure that we are amplifying and scaling up this work that we're doing to ensure that we're having a systems impact? And so I think we can open it up for questions and conversation now. Yeah, Angie, does that feel right?
That sounds great, Montrese. And I'm sure we will have questions. Everybody feel free to either raise your hand or add them to the chat. But just one question we wanted to start off, as you have all of us here, a group of partners from different sectors who are really interested in seeing this succeed. Are there some things that we all can do to help you make sure that this is the success we all want it to be?
Well, you know, I think that there's a contribution that all the partners have to this vision of what this transformation should look like. And so these sort of convenings, these sort of opportunities to talk about that, I think are important. Like, what does transformation mean to all the players in the field? What does that look like? I also think that, you know, as we're collecting information on the needs of the field, we need to hear from you. We need you in the places where we're doing the key informant interviews. And I'll let Caitlin speak to that more. But to share your existing needs assessment data so that we can include it in the analysis, to share what you're hearing from the folks you serve in the fields, that we can ensure that the proactive technical assistance that we're offering is really in service to the field, and not more of the same, which is critically important, I think, if we're going to transform the system. April, Caitlin, other thoughts? What did I miss there?
Yeah, no, thank you, Montrese. So one piece of the puzzle is a foundational needs assessment and gap analysis. Part of the way that we are going to reduce burden on grantees that I didn't mention earlier is by making sure that we are assessing what do we already know and casting a very wide net in terms of existing data that are already out there that can tell us what are the challenges, what are the gaps, what are the needs, so that we are not pestering our wonderful local health departments who we know are already, you know, understaffed. That's the point of the grant, and who really don't need just one more survey. And so our partners at the University of North Carolina, the North Carolina Institute for Public Health, are conducting a foundational assessment and gap analysis, which is really surveying the field and trying to bring together all existing extant data regarding foundational capabilities and workforce so that those can then inform our training and technical assistance so that they can be proactively thinking through what types of TA would be most important for the grantees. So, you know, making connections with North Carolina, the North Carolina team via NNPHI would be great. If there are like existing data, you know, they're already ongoing and they're already collecting information, but if there are particular data sets or resources that folks are, you know, aware of or would like to connect around, that would be great. And another opportunity in reducing burden is we are trying to leverage existing convenings where grantees might be present and use, rather than saying, hey, everybody, hop on a plane for a few days and, you know, take this time to meet with us, saying, you know, if you're already going to be at this meeting, let's carve out some time to do a key informant interview, to do a focus group if we need to perform primary data collection. And so, you know, we're looking to partner with different organizations and existing convenings so that we can utilize some of their existing convening space and time to meet with folks, and in that way, reduce the burden.
That's
and
great.
I wouldn't add much more than that. I would just say, you know, especially providing these spaces for us to share and elevate the work is really important. And as the space is provided and as we present and share with you all, especially with this interdisciplinary group, I think it's a great opportunity for us to check our blind spots, hear really from the field about what are we missing, how can we do this work better. So I will just leave it there.
That's great. And I would say for everybody, if you have meetings or opportunities where you think makes sense to share this information, why don't you email us at alliance@apha.org and we'll collect it and send it to our colleagues. I have Michael Berry and then I have Steve Greeley, and then we'll go from there.
Great. Thanks. Thanks, Montrese and Caitlin and April. That was a great update on what you're doing. And we're really looking forward to working with you guys as partners. One question that I kind of had all along is like, what are the grantees, the Component A grantees level of awareness of the national hub, and what's going to be the plans to increase their awareness, or is it going to be like CDC directing them to, direct all of their requests to the hub? Because I'm wondering about, requests that they may have with their own Component A monies that they're looking to reach out and get technical assistance from other partners. Like, how is that all going to be coordinated? So I know that that's a lot, and I'm sure you guys are probably trying to work through all that. I'm curious of your preliminary thoughts on that.
Immediately, part of our responsibility is communicating the availability of technical and training assistance to the grantees, and ASTO is taking the lead in communications. I would say that, as we are learning and growing, there have become many more opportunities for us to talk to the grantees around what we have to offer. But they submit their technical assistance requests, the sort of reactive TA that we're offering, through a system called PHIG. Please don't ask me what the acronym stands for, but it's PHIG. April or Caitlin may know what the acronym stands for, but they'll submit their TA request in that system. It is then tracked, so we kind of know what is happening. And then we're thinking about how do we then share what's been created, what's been developed or done for one grantee with the other grantees, so that we have more of that systems approach. And ASTO has several communications mechanisms for that, weekly, monthly newsletters and things like that. And then the project officers at CDC are also deeply engaged in this. And each grantee, I think each has their own, maybe each doesn't have their own, but project officers have few grantees under them, so they can provide true customer service. And so we're working closely with them to be able to develop that relationship so that the grantees know how to find the information. But Michael, this question around if a grantee wants to do something, whether it should be a TA request in the PHIG system, or whether they should use their grant funding to go and subcontract with someone else, that's come up. And where we've been asked, or where we've been in those conversations, the goal there has been to just avoid duplicating efforts. So if a jurisdiction is asking for or paying a contractor to do something, we're asking that they put that in PHIG as well, so that we can track those. So I hope that kind of answers your question. This is going to be a figure it out as we do it kind of momentum, but that's the sort of approach that we're taking right now. Caitlin, April, did I get anything wrong there?
No, I think I would just add on, if you're curious, PHIG is the Public Health Infrastructure Virtual Engagement Platform. It took me like five rounds to actually get that acronym right myself. But we are currently working on putting together an outreach plan for the hubs to kind of announce their role in this work to the grantees directly. I think there is a role for the CDC program officer to kind of be that conduit. And we do expect eventually that as we continue to build these relationships, especially better relationships between the regional hub and the grantees under their purview, that they probably will start reaching out directly to the hub for potential technical assistance and not going directly into PHIG. So we're expecting that, and we're just kind of fine tuning the process right now. And when that does happen, PHIG is that system for logging and tracking everything. And then, we'll get to a point where the hubs are logging those activities if they're working directly with the hubs or working with the grantees rather than the grantees going directly through that PHIG system. So it could happen a number of ways, but we do think that outreach and engagement with the hubs is very important.
Great. Steve, I think I see you next.
Thanks. One of the initiatives of this alliance is the creation of a national strategy to provide support for community-based collaboration, having a specific focus on coalitions that have strong resident engagement, but also for those with whom residents need to work to have a voice and influence public health equity and progress. And the strategy is going to involve components that include technical assistance and a whole variety of information resources. I'm wondering if this topic has a relationship with the work that you're doing.
I can
It
add
sounds
something
like
there.
it.
Yeah, it's especially through the hub work, and I will, Montrese, please chime in. But we're thinking about sustainability and equity throughout the grant and also beyond that. And I'll share that we have been doing sort of a roadshow with all of the regional hubs and talking about what they want to do with this work, what they want to see in their region. And that equity and sustainability piece has been a big topic of conversation. And so we can't just be thinking about, by the number of staff that are being hired on at these health departments. I think the capacity building is not only internal, and I think that the hubs are really thinking about what kind of technical assistance can provide leadership and coaching to that high level of the health departments that will help them build stronger partnerships and relationships with community-based organizations for shared services. What can the HR department do to recruit people from the community that have lived experience and not just these degrees and traditional, work experience that normally gets you into public health. So that's just a few examples that we're talking about. That's some of this work I think that I think will happen through this grant that I think relates to your question. And I'll see what Montrese and Caitlin want to add to that.
Yeah, I would just add that I think that oh, sorry, Montrese.
No, go ahead. Go ahead.
Okay, sorry. I was going to say, I think that there's an additional opportunity for that type of engagement via the evaluation because of the evaluation advisory group. The way that initially for year one, we're going to be recruiting for the advisory group primarily from recipients, just because there's 107 recipients and we just need to get it off the ground. It's a lot of folks. But from there, we're interested in inviting recipients themselves to identify other potential users of infrastructure grant findings, including folks who may not be, funded by the grant or traditional public health partners. And so we're interested in exploring the opportunities to have more community-based partners at the table as well as users of the information. So I think that represents further down the road another opportunity for engagement in a way that's a little more unique, which we're really excited about.
Great. Thank you so much. This was really exciting and really helpful to hear about. I think we're looking forward to hearing what's coming forward. As I put in the chat, I know we didn't have a lot of time for questions. So if you all have questions or things, feel free to enter them in the chat now or send them to us and we'll make sure to send them to our partners later and maybe we can send you the follow-up later. But thanks so much, Montrese, April, and Caitlin. We really appreciate it.
Thank you for the opportunity. You all have a good afternoon.
Thank you.
Thanks,
So,
everyone.
Thanks so much. So a couple of quick updates. One is just wanted to make sure that everybody knew about our request for information that is out now from the House from Representative Miller Meeks. I'm really focusing on CDC. There's a fancy QR code here, so please feel free to go ahead and look at that. But we're happy to share talking points or other guidance that people would like to apply. But I think it's an important one for those of us to weigh in and on the field. And comments are due on April 23rd. One that also there's no QR code for, but we also know that OMB has requested information about data, especially around new standards about race and ethnicity. That also is being coordinated now by some partners. So that's another that please feel free to look at or email us and we're happy to send you some information about. So two things we thought were really relevant to what we do as the Alliance. And so just wanted to make sure you knew about them. But this is a time where we wanted to share a couple updates. So we're going to start, I'm going to hand it over to our colleagues now at NP3, I'm sorry, at IP3, who can tell you a little bit more about PHERN. And Erin and Liz, I don't think you have slides, but if so, let us know.
I'm muted.
I think
We
you're
do have
unmuted.
a couple if it's all
Okay.
right. So I will share my slides real quick. Yeah, so thanks for the opportunity to share a couple quick updates on the PHERN front. And as I go through these, Liz will be sharing some links into chat. So keep an eye out for those so you can go check these things out live. So the first new feature on PHERN is the ability to save your favorites. So what you're able to do now is create an account, and Liz will share that link to set up your information. And when you do that, you'll be asked to select your topics and sectors of interest. And that will auto favorite those items for you so that you can have kind of a quick link to get to those in the future. As well, as you're browsing through the site, you'll now see, once you're logged in, little hearts in the upper right-hand corner, and you'll be able to grab things that you're interested in to very quickly come back to. So what you're seeing there on the right is an example of what the My Favorites page will look like. Once you've saved a few things, you can see you can find some resources, topics, and sectors to come back to later. So that's one update I wanted to pass along. The second is, even though National Public Health Week is over, we wanted to make sure you were aware of this collection of resources that we created to support National Public Health Week, because there's still a lot of great content in there that will be relevant. And also wanted to just make you aware of this kind of opportunity where PHERN might be able to support an event that you have coming up. So there are ways that we can actually pull together resources and spotlight key topics for folks to dig into. So again, Liz will share that link into chat, and you can take a look at it and just see an example of what one of these sort of event spotlights can look like, where we can pull together a number of pieces of content, kind of give you one quick link to share with your partners and stakeholders to be able to access a whole repository of information. And then the last thing I wanted to update you on is a new body of knowledge or toolkit that we have on PHERN, which reflects a set of content around protecting public health authority and advocacy. There are a number of resources that are collected here, and this will no doubt grow. So this is a new kind of body of content within PHERN. And again, I show this not only for you to know that it's a resource and to refer back to, but also just to keep in mind, again, as you're working on content, perhaps you're developing a resource library or a body of knowledge that maybe has a specific topic. We do have the ability to kind of create these sort of mini portals within PHERN to focus on specific topics or events of interest. So check that out. We'll continue updating that. And as always, a couple just sort of ongoing asks that we have of all of you. One is, please let us know if you have a resource you want to highlight on PHERN or add to the PHERN resource library. We can add a link, and I don't have this one readily available, but I can drop it in a moment around how to suggest a resource to PHERN, or simply emailing Angie or Raya or myself, and anyone on the PHERN team will get it in there. And then the second one is just spreading the word. So please do let folks know that PHERN exists as a resource. We really, rely on this entire alliance of folks to continue to get the word out so that this can be a resource that's useful to all of our sort of collective set of users and constituents. So those are the quick updates I have. If you have any questions, let me know, but otherwise check out those links that we shared in chat. Thank you.
Thank you so much, Erin and Liz. As you all can see, there's some exciting new updates for PHERN, and this is all of our resource. So please let us know how it can be helpful or ways that we can help to build things out that would be helpful for all of you. But yes, we have a couple minutes left and just wanted to have a chance, whether through chat or raising hands, to let people share other exciting things that you have that you think either issues we want to deal with, resources we should know about, or other things for the good of the group. Okay, I see Steve.
I just wanted to report that, as I mentioned a few minutes earlier, we are creating this national strategy for community collaboration support And we have been holding a series of input sessions for people who are working in community-based coalitions or who are working with community-based coalitions. We've been very fortunate to have IP3 and Healthy People, Healthy Carolinas, and Resilient American Communities all help bring people together for us to talk with. And the input we're getting is actually very strongly supportive of the strategies that have been evolving through this process. And so we're getting to the final stages of that planning, and that will be part of that report that Susan mentioned at the beginning of this call. We'll be able to share with you to really have a strong national strategy there. Thanks.
Thanks, Steve. Anything else I see? And everybody feel free to use the chat also. As Donna did, we're happy to share questions for follow-up. Also, people, I know we just have a minute or two left, so you're also always welcome to send it to us and we can forward it to people as updates or other information. Anything? I know all the amazing things y'all do. All right. Well, I know we're just about out of time, so please share it with us. But thanks again to our presenters. Thanks to all of you all. It's always a pleasure to have a chance to see you all on a nice afternoon here in the spring. And we'll look forward to touching base again next month. Next month, we will actually have Kaiser Permanente talking some about their new work. So we'll look forward to having them join us too. So thanks, everybody. See you soon. Bye.